Hey guys, this is David from OT Focus, and today I'm at Bishop's Peak, and I'm going to talk to you a little bit about what you can say to a physical therapist when they ask you why you're walking your patients. So a while back, I actually had a physical therapist come up to me and ask me if I was walking one of his patients. And I said, of course, yes, I'm walking your patient. And then the follow-up question he had for me was, how many feet did you walk him? So I think he was just trying to see if I was trying to document feet or ambulation distance. So for some reason, I feel like walking is like this weird territory in healthcare, in rehab or a hospital setting. And I feel like it's completely fine as an occupational therapist, but there are definitely some places you can work at and people will just, some therapists will get upset. Some directors won't let you walk their patients and they strictly want you to do ADLs. But for most people, I think walking is totally fine. So I know this subject is a little bit controversial because usually if you work at a clinic or you work at a hospital or rehab facility, a lot of times you'll just get these vibes that physical therapy doesn't really want you walking your patients. So I think one thing you can say to a physical therapist is you can ask them why are they getting your patients on the toilet? Why are they doing ADLs? Because physical therapists and occupational therapists overlap quite a bit. And anytime we do any functional mobility or any ADLs, we're gonna be ambulating them. But you can also say that ambulation is in the practice framework, and everything we do in occupational therapy and almost every ADL is ambulation. Now, I know this is kind of a hard topic to discuss, but I think it's important to kind of stand your ground and stand your field because I feel like as occupational therapists, we're kind of the underdog and a lot of people are just kind of walking over us a lot. So I think it's important to kind of just stand up for your profession and speak your mind. And if you're gonna walk the patient multiple times a day and if physical therapy can't see them because you walked a patient, that's totally fine. And you don't have to count feet, you can just count minutes in your documentation. And you can also document that you're working on household distances, or you can work on a goal so a patient can be able to walk to their mailbox. So why does physical therapy not want you walking their patients? I think it's just because physical therapists are really the experts at walking, at ambulation, at charting distance, at doing gait assessments. So they're really in charge when it comes to ambulation and if a patient has any problems with ambulation or any gait disturbances. Occupational therapists are also really good at ambulating and understanding gait problems. But the thing is, occupational therapists aren't experts in that field. But every ADL that we work on is part of ambulation. If you're getting a patient up to a shower or you're getting up to a toilet or you want them to put pants on, all of those things you have to be able to stand up, and most of those things are being able to walk. If a physical therapist comes up to you and says, why are you walking a patient? I would say it has to do with everything you do as an occupational therapist. So we are measuring household distances. If a patient can be able to walk throughout their home, we're measuring if they can walk to their mailbox, we're measuring if they can do their normal daily routine by going to grocery shopping or the doctor's office. Anything a patient tells you that they do on a daily basis is part of their daily routine. And if it requires ambulation, by all means, we should be assessing it. And if physical therapy has already assessed it, that's fine. But don't be afraid to assess it again and do your own assessment because we test different things. If we have to see if they can walk to their mailbox and see how much exertion they're gonna need, if they're gonna need oxygen, that's something we can assess that's in our domain of practice. Now, a lot of physical therapists will say that's not part of occupational therapy, and you can actually point them to the OT practice framework. So there's a section in there that talks about our domains of practice, and it actually says functional mobility. So if PTs have a problem with you getting patients up and out of bed, show them that portion of the practice framework that says this is our domain of practice, and that's definitely something that we can do and work on. Now, most facilities will say, well, can you just work on ADLs, because a lot of times patients will get tired out and they won't want to see OT after PT saw them. And I feel like a lot of times PT gets upset because their patient won't want to walk with them because they already walked with OT, and then PT has nothing to do. Whereas OT can still work on ADLs. And I feel like that's a valid point. And I would say I think physical therapists, maybe they should be seeing the patient first and then have OT come in afterwards to assess ADLs and then also their functional mobility. But I feel like it's really up to you. Like, I feel like it's so important to be getting these patients up as many times as possible throughout the day. So if a patient just doesn't want to get out of bed again, like, I feel like that's where PT comes in and tries to motivate them, because that's what OTs do as well. If I have a patient that doesn't want to get out of bed, a lot of times I won't even see them, because everything with ADLs has to do with getting out of bed. I can't just work on a patient and have them brush their teeth while they're in bed if they can already do that independently, and that's not a goal I'm working on. No, I'm mostly like trying to get patients out of bed and just assess their mobility while they do ADLs. Yeah, that's kind of the annoying thing. Like, a lot of physical therapists will be like, well, now I can't see the patient because you already walked him. Well, it's like, well, the same is with me. I can't see the patient if you already walked him and they don't want to get out of bed and get on the toilet or get in the shower. Like, it's the same issue with us. So I feel like it's definitely something that needs to be addressed, but I feel like OT and PT both need to be getting their patients out of bed. Okay, I hope that was helpful. What are your thoughts on this? Is this really controversial? Is this controversial in your practice? Leave your comments down below, and definitely like this video if you can, because it makes a huge difference for this channel. And subscribe, and I'll see you in the next one. Thanks.